Hello, this is Karen Cook from the Home Modification Occupational Therapy Alliance, HMOTA. And today we have a special guest with us, Guy Miller. He's the epidemiologist from the Berrien County Health Department. Welcome, Guy.
Hey, Karen. Thanks. Good to be here.
Today, Guy is speaking to us on how to get parents, or if you are a snowbird, home. Is it a good time to come home? I know my parents are in their late 70s and they would like to come home. We've had a lot of discussions as far as the best way to do that. So here's Guy to give us some advice about what we should do as far as people who are far from home and would like to come home.
Yeah, thanks, Karen. And an interesting question. We haven't really had that come up yet with the Berrien County Health Department. We're focused right now on how to provide the best care to really the elderly population, and for that matter, anybody over the age of 65. I can tell you right now, 87% of the deaths in Italy, 87% have been in people that were 75 years and older. So obviously, older people are a huge focus in this pandemic and our response to it. So, the questions that you're asking, we haven't really thought a ton. We've been mostly coordinating with long-term care facilities and adult foster cares and senior living centers with how to help them out when they have their first case of COVID. And in a lot of situations, we think they will have one coming up shortly. So it's just not really a matter of how to prevent it, but what to do when you'll get it. So your question about kind of snowbirds coming back is another really great question. What do we do? So the governor, at least in the state of Michigan, did put out a stay-at-home declaration and wants everybody to stay at home. And really, the idea of this is the CDC is telling us that within 48 hours of your first real symptom, you could be spreading COVID-19 asymptomatically, or you could be spreading it with mild symptoms. So that means 48 hours before you have any idea that you might be sick with COVID-19, you could be infectious. So one of the recommendations kind of based on this now is, well, obviously, we don't want anybody congregating together. It started in like people of groups of 500, then groups of 200, and then it went down to, I think the governor said 100. Now they're saying no groups bigger than like 10 people should gather. And the idea is that 48 hours before you're actually sick, you could be spreading something. So the idea here that we're trying to focus on is you could be a spreader of potentially COVID-19 and have no idea that you're spreading it to people. And one of the recommendations the CDC is putting out now is to wear a mask whenever you're out in public. And that's not to prevent you, the wearer of the mask, from getting an illness. It's actually to prevent me, the wearer of a mask, from spreading anything that I might be carrying that I don't know of. So when it comes down to snowbirds, and when we're talking about traveling potentially across the country to get back home, I think the best recommendation right now is to stay put, stay at home, and don't travel. I know there's a lot of conflict around that, and just kind of, you want your loved ones to be close. Well, right now, you shouldn't even be going to visit your loved ones because we're supposed to be on lockdown, not going anywhere, staying at home, just around our particular people we're next to. And the epidemiological reason behind this is if I never pass the disease on to somebody, if I get infected and I never pass it on, well, as soon as that disease has run its course in my body, it's not going to be able to replicate, and it's not going to be able to infect more people in the community. Even if it's just in my household, if I had 3 people in my household or something, if we all get infected with the virus and then we don't spread it to anybody else, in theory, it will end viral replication and will put this pandemic behind us. But we know that people are continuing to travel. My mom herself is a nurse, and she knows of many people that went to Maine for spring break, which is an awful decision, especially because a lot of these lockdown orders are going to be controlled by the states. So if a state decides, let's say if you're coming back from Georgia or coming back from Florida, and a state such as Georgia decides that if they pull anybody over and they're from out of the town, they're not going to let them continue through their state. That's very possible. Rhode Island right now is like on strict quarantine. And if you have a New York license plate and you get stopped, they're going to ask you to go back and they're going to monitor you for 14 days to make sure that you're actually doing what they requested. So I don't think driving is a really good method. And even if we just look at geographically, where besides Louisiana, the northern states versus the southern states seem to be doing a little bit better with COVID-19 in terms of the number of cases they're having and the severity of the illness. So there is a little bit of evidence that suggests Florida might even be a safer place for your parents to stay. We don't really know what's going to pan out. What happened last week is, most people couldn't have predicted, with the number of cases and the number of deaths across the nation and even here in Michigan. We unfortunately, we don't know when a safe moment will be for people to continue traveling. So our biggest recommendation is just to adhere to what the state governments and the federal governments are saying, which is stay put, stay home.
Okay, thank you so much for that, because I know that will settle some discussions for a lot of people, especially in my family. And I know you've got absolutely no crystal ball on this, but is there any chance that they could come home, say, early summer, or just you can't even make a guess at this point?
Yeah, I wish I could make a guess. For like right now, I'm not predicting that this goes on for several months. I'm hoping that it gets it kind of phases out here. If we do recall, like what happened with SARS, Toronto, Canada was one of the biggest outbreak areas, and seasonality did play a little bit of a factor in it. And similar to COVID-19, it's a coronavirus. SARS was. That's SARS-1, and this is considered the SARS-CoV-2 virus. Just the names of the actual virus. The disease is COVID-19. So in terms of that, it does look like, either great public health protected it, or it could have been a little bit of seasonality. We know that droplet spread is a little bit less likely in more humid environments, which could play a little bit of an impact. Now, is that going to be enough of an impact to affect an entire pandemic? That's the million-dollar question. We don't know. We don't know what all of the factors are, what all the risk factors are with this. It's a new virus. We first discovered it in December of 2019 in Wuhan, China, and it's been studied very closely ever since. But obviously, we can't tell you how a virus is going to last over a year when we've only known about it for 4 months.
That's such a short time. So why would seasonality and humidity play a part as far as the virus being able to be strong and spread and people get it or not get it?
Right. Some of the theories behind this is kind of like a relative humidity. When you exhale with 100% humidity, and obviously that's not just water. It's your upper respiratory secretions are going into the air, and then you're breathing them out. So in the course of time, if we were sitting in the same room, just talking and talking and talking and talking, the more respiratory secretions I would be putting out into the air, and kind of this like plume or this cloud of my own humidity from my mouth has increased in this room. So the idea about wearing a mask is that stops those respiratory secretions from going as far and from being just kind of pushed through the air as much. So the idea is if you have like competitive droplet particles in the air of just regular relative humidity from whether it be rain or not respiratory secretions from you or I, that those are competitive for how much of your own respiratory secretions you're able to put into the air. I think a lot of that is just a theory into why humidity can play a difference in disease spread, but the idea of the disease spreading is person-to-person contact, not necessarily grocery bags or fruit and things like that. It's more likely that if you're getting COVID-19, you're getting it from a person-to-person spread, not picking it up off some surface. Another good point, just kind of about, everybody's heard this idea of flattening the curve, right? Have you heard that, Karen?
Yes, I have.
So the idea is to decrease the incidence so that we don't see as many cases right away of COVID-19, but we see it over a long period of time, right? And if we can keep that curve low, and if the y-axis is the number of people who are sick with COVID-19 and the x-axis is time, we want to see, essentially, we're going to have the same amount of people infected with COVID-19, but we want to see it stretched out over a long period of time and not kind of all in 1 month or in 1 week. The idea behind that is when we don't have the necessary medical equipment to save people's lives, like hospitals and ventilators and hospital beds and IV bags and things like that, that is when we start to see deaths increasing. So it seems like in just looking at our hospital's data, a lot of people are treatable. Unfortunately, about 25% of those who are ventilated will make it. So only 25% make it once they get to the point where they need to be ventilated. But it is looking like we are keeping our hospital burden down in some areas. I know Berrien County is doing really well, knock on wood, with our overall surge capacity for the hospital, but we don't want a sudden peak. We don't want all of our long-term care facilities and AFCs to start having cases. It would be better to have one facility at a time, kind of have a few cases until we can really get some good treatment for these individuals, or we can find a vaccine.
Okay. Well, thank you so much for your time. I so much appreciate it. Again, this is Guy Miller from the Berrien County Health Department. Do you have any other parting words you would like to share, Guy?
Just what we've been saying. Stay put. Lockdown. We've got to handle this as a community. The best thing you can do to protect those around you is actually to not visit them. The CDC is recommending now, if you do go out in public, make sure you're wearing a mask, just because we are concerned that you might be spreading it, not you might be getting it from someone else. But that is the purpose of a mask, to protect everyone else from you, really. And continue washing your hands, practicing social distancing, staying 6 feet apart, and things like that.
Wonderful. Thank you so much.
Yeah, thanks, Karen.
Again,
My pleasure.
Yeah, thank you. Again, this is Karen from the Home Modification Occupational Therapy Alliance, HMOTA, and please take